The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. On today's show, I have David Kirby. David is CEO of Avida Global. Avida are a British medical cannabis company who are cultivating in Colombia. David, welcome.
Thank you. How are you?
I'm very good. How are you?
Good, thank you. Good, thank you. Surviving lockdown somehow.
Yeah, it's going on for a bit too long now. But let's get on to the main topic of conversation, cannabis. We'll go on to talk about what Avida are up to and a bit about how it came to be. But before we go there, could you maybe just start with a bit of an introduction about yourself and your background and what you were doing before and how you got into cannabis?
Sure. Yeah. So my background, if I go way back, actually started with music. So did a music degree, but there's very little money in music unless you're right at the top. So that was a long time ago now. I still play as a jazz pianist now, but it's for serious fun now. But yeah, started in business working for some large consultancies. So I worked for a company called Capgemini Global Consultancy, sat on the UK board of that company, and then the European management team, and then spent some time with Shell, and which was great fun. But about 9 years ago, I decided that I really wanted to get more into startups and growing businesses. And that's what I've been doing. And it was through that journey that Avida Global came along nearly 3 years ago now, where we had the opportunity for a fantastic piece of land in Colombia. And at that time, there was lots of excitement around medicinal cannabis. So we started doing a lot of reading about it. And it's one of those subjects that the more you read about it, the more passionate you come about it. You realize, how old it is, going back to the Chinese and the differences between Western and Eastern medicine, and read lots of books since then. And the more you get involved, the more fascinating it becomes. So we started Avida Global, my colleague Carl Hafter and myself, and it's been a roller coaster of a journey since then, enjoyable roller coaster of a journey. Yeah, and here we are now.
Yeah, I always like to, it's great to hear your background. I always like to ask around the decision to go into this area, because obviously, it's been laden with a lot of stigma and misunderstanding over a number of years. Was it a difficult decision for you? Did you face any kind of slightly odd looks from friends and family?
My friends call me Don David now. So the international drugs baron, they think it's so funny. But no, but when we went into it, well, it's partly to do with the name. When we chose our name, Avida Global comes from La Vida, life to life. And, that was very much what we wanted to do in terms of medicinal cannabis and the difference it can make to people's lives. And also, when we got into it, it was a time that certainly in the UK, it was verging on a knife edge in terms of, is this reputable or, is it legal even? And so at that point, we also decided to ask a gentleman called Lord Mancroft to be our chairman, who is one of the leading spokesmen for drug reform in the House of Lords. And, that was partly not only because he's a fantastic chairman, but it also, we wanted to show that we were doing this seriously and had integrity of intent. And it just wasn't sort of riding, as it was, the green wave, as it's called, and coming at it with serious of intent and purpose.
Yeah, that's brilliant. There's not only, I guess, the respectability of probably an establishment figure, I suppose, but also the fact that he's an expert in the field of drug reform is both a good thing for the company and the space.
Yeah, no, absolutely. And we even got him doing an interview in Colombia on Colombian radio, which was all in Spanish and translated in Spanish. But it was the local radio there, and they were so privileged to have a lord of the realm on the Colombian radio.
Fantastic. I love it. Cool. So, let's talk a bit about Avida then. In that case, why don't you just, give us an overview? What does Avida do?
So, as an overview, we're focused on medicinal cannabis on a global basis. We chose Colombia as the place we wanted to cultivate and manufacture what we're doing. And perhaps I'll come back to Colombia in terms of why Colombia, but we're based in northeast Colombia in an area called Cesar, which is a huge national park around there. It's an absolutely beautiful area. It's at the base of the three ranges of the Andes, east, middle and west, where they all terminate. So we're in this sort of bowl there, which is absolutely beautiful. It's very, very hot, very dry, and the people in that area are absolutely fantastic, and we've get more and more involved in the community there. So that's where we are. We've also got a headquarters in Bogota as well, where a lot of our more senior staff are. And I suppose a bit about why Colombia is, we had a view right at the beginning that the best place in the world to grow cannabis would be on the equator, where you're getting 13 hours of sunshine a day. And, it is a very, very complex crop. And, if you look at, perhaps what a lot of people are doing in less temperate climates is, growing in greenhouses, which are then underpinned by technology, be it air conditioning, lighting, heating even, and it can get very, very expensive. And clearly in Colombia we don't have that sort of technology expense of heating and air conditioning, etc. But with that constant light of 13 hours a day, it means that we can effectively literally do 5.5 to 6 crop cycles a year, which is a lot more than what you can do if you're not on the equator. Not that we do sort of large harvests. We're harvesting on a batch basis, micro batch basis. So doing harvest literally 3 harvests a week as we go through. But that is part of the benefit of Colombia where we are. And I talked about greenhouses, and notwithstanding that, we still grow in greenhouses, but it's a greenhouse that has been developed purposely for the region that we're in. So we literally took something like 20 years of weather data where we are looking at humidity, winds, rain, sunlight, heat, and modeled that. And our greenhouses are there to, if you like, exacerbate all the good elements in the environment we're in and keep out the bad elements, such as, pesticides or cross-contamination, excessive wind or rainstorms or what have you. So, it gives the plants this beautiful environment. And as our master grower says, who's a sort of wonderfully philosophical man, who says, I can literally see the plants smiling because they like it so much. Which is fantastic. And then, so they get their 13 hours of natural sunlight, and then we literally say goodnight to them when the sun goes down, and, the plant literally goes to sleep. And then the only time we the only time we do use lighting is in when we're putting the plants into their vegetative stage. So we actually give them about 21 hours of light at that point by enhancing it with artificial light. So they get about 21, 22 hours of sunlight. And what that does is just produce much stronger root balls, much stronger plants. And they're there for, I think, about 25, 28 days. And then we take them out of there and put them into our production greenhouses where it's all then natural.
Fantastic. And just as an aside, were you a gardener originally, or have you just learnt a lot about cultivation through this experience?
No, just learnt a lot about cultivation. So my wife won't let me go near the garden. So, but no, it's been absolutely fascinating. So my partner, who founded Avida Global with me, Carl, he's comes from a horticultural background. So his degree was actually in horticulture. So he's come full circle. But no, I've been fascinated by the whole thing. And, it's a shame we've had lockdown at the moment, because I spent a lot of time in Colombia in 2019 and just standing there listening to our master grower Ricardo talk about the philosophy for growing and how he does it. It's absolutely fascinating. And he's got a couple of hydroponic patents to his name. So one of the things that we did do is choose to grow hydroponically for a whole host of reasons. So we grow in a benign substrate, which has got the substance, or it looks like soil, but it's not. It's just completely benign, but it allows the plant to take root and form structure. But we then feed all the nutrients, everything that the plant needs. We define and decide when it is according to the growing cycle of the plant. And part of the reason that we did that, I think, is twofold. One is, everybody knows that cannabis is a bit like a sponge that's, will soak up anything that's in the ground, heavy metals, pesticides, soak up anything in the air. In order to get purity of what we do, growing to GACP standards, all the rest of it is, we wanted to be able to control every single variable of what is a natural process. And so by growing hydroponically, it means that we can control all the nutrients. And we use something called epigenetics, which is sort of a way of growing, which is effectively collecting a lot of data about the plants and how they thrive, when we water them, how much we water them, how they respond, what time it was, what was the temperature, all the rest of it. So we can continually model all that and continually improve with the genetics that we've got. So we totally optimize the environment for them and, everything around them in terms of how they grow. So the whole thing is fascinating.
Yeah, fantastic. Could you go into a bit more detail on the epigenetics part? What are the kind of optimal growth? I mean, there's probably going to be thousands, but what are the key ones, growth factors?
Yeah, the plants, it's a whole variety of growth factors, but, plants have, various demands in terms of light, how much light, the intensity of light, heat, the humidity, as well as all the nutrients and irrigation that they receive. And what we're doing is just constantly collecting data on all of that and feeding into our IT system. And that links all the way through to, when we finally produce oils. And it will take time. This is not immediate, but, over, months and years, we're getting more and more data in terms of what the plants best respond to, and even down to when you harvest them as well, to maximize the quantity and quality of oil that you're able to get out of the plants. And, rather, we have got a lot of genetics where we are, but we're sort of very focused on specific genetics in terms of how they respond in the area that we are and what we need to do to just literally increase the veracity of that plant in terms of velocity of growth and the quality of the oils that they produce. And it also comes down to plant failure as well. And so far we've had very, very few failures in terms of taking a clone and taking it through the terrariums and into our vegetative hardening area and into the production area. So it's an ongoing process.
That sounds very positive.
Yeah, and and not all areas of Colombia are the same. It's a very, very big and diverse country, and there's lots of very good growers across the country, but growing in different environments. So we're 300 feet, above sea level. We have very little humidity. It's a dry heat. It does get very hot. You can get up to 40, 42 degrees, which is fine. The plants love it, but you can control the heat in the greenhouses. And our strains respond very well to that. And particularly, we're now moving on to THC strains as well, and they also thrive very much better in sort of higher temperatures. But all the genetics are different. So people are growing in different areas of Colombia, maybe in the Bogota Basin, which is, at higher altitude. It's much cooler there. There's other people growing up right in the north of the country where it's, more humid. So you have different strains for the environment that you're in, just in order to be able to maximize the productivity of the plants.
Yeah. I mean, I was going to go on to that point, actually. We've had a couple of producers from Colombia on the show, or companies that are based out there. It seems like there's a few people who are sort of drawn to Colombia. How are you seeing that kind of shakedown?
It's what I would say is not all areas of Colombia are the same, because you can get parts of Colombia that are just too humid or too cold. And so, I think the good things about Colombia is, they've got one of the most comprehensive licensing regimes in the world, which has been copied by other countries. It can be fairly bureaucratic at times, but it is, what they're trying to do is be very professional what they do, and, ultimately becoming one of the top producing countries in the world. And the other thing about Colombia, it's a huge market in Colombia and a huge market in Latin America as well. Even though we're looking at a global basis for our market, but it's also the skill base in Colombia as well. It's incredible. I know people that are growing in Africa and other, Eastern Europe, etc. And a lot of the skills around cannabis have had to be imported from California or Canada to bring them in. But what we found in Colombia was, well, to give you an anecdote, when we first started off, we approached a global headhunter to go and find us the key skills, some of the key skills that we needed to start building the team out. And I was surprised that this global headhunter not only had a big office in Bogota, but they had a special division that was focused on medicinal cannabis. And you think, wow, this is really advanced. And when in the UK, it was still just a part-time discussion, and they were really focused on it, and they were able to produce incredible candidates for us that have had maybe 2-3 years experience in this, come from a huge background of agronomy or from the pharmaceutical industry. And as a country, the Colombians have responded in terms of training skills. So a lot of the top universities are now churning out agronomic engineers with specialisms in medicinal cannabis. And so plentiful of skills out there, but also there's value for money in terms of those skills, in terms of what you'd expect to pay for those skills in Europe, for example. Is very different for what you would pay in Colombia. And we like to think that we're one of the very good and fair paid payers for our people out there, but you get a lot of skill for your money. And if you like that's the top skills around the agronomy and the growing science, but also the from the pharmaceutical side and the chemists as well. And a lot of those skills tend to come from the major towns. And then the local skills that we're using in the greenhouses, we're using that to take the opportunity to ensure we train very, very good people locally. So we're in an area that is not one of the wealthy areas of Colombia. It's a town called La Joa, probably about 47,000 people, I think. But the biggest industry is, funny enough, a UK mine, which is about 5-10 kilometres away, which has been a big employer of the town. And that's actually cutting down at the moment in terms of production, and therefore people it employs locally. So we've been working with the local mayor to say, look, we need skilled people. And so we go through a fairly rigorous interview process when we take people on, because we want the right quality people. But taking people out of the local what are called Sena colleges and bringing them in, and there's a lot of agriculture around there anyway that people have naturally been used to, avocados or coffee or whatever it might be.
Yeah,
I was going to say, all in all, a great place. And, it's just a stunning country as well. And, we invite all our shareholders and management that, do come out and see it, come and see where we are. It is just so stunningly attractive. I even took my family for a holiday there in Christmas 2019 over the new year of 2020. And of course, we did all the fantastic places in Colombia, like going to Cartagena and Bogota and national parks, Tironi and Palomino and what have you. But the most enjoyable part of the holiday for them is when they drove down to the farm and just saw the sort of splendor of it. So this is absolutely fantastic and vast.
That sounds fantastic. You got in there right at the right time before all this craziness happened. Well, there's loads there. I mean, the Colombian bit is, like I said, we've had a couple of guests on before, and similar to you, they all are kind of amazed at how kind of fertile and how incredible it is for growing just, any kind of produce. So that's definitely a ringing endorsement. Well, maybe you could talk a bit about what exactly are the products that you're making and who are you making them for? As in, what's your where's the demand coming from, I guess?
Yeah. So, first and foremost, we're not a recreational business. We're very much focused on the medicinal cannabis side of the business. So all our quality standards are targeted at the pharmaceutical and medical market. So we're going through the whole process of GMP, good manufacturing practice, EU GMP at the moment. All our designs, everything that's been going back 2 years now, has all been designed around the process of GMP. So not only the equipment, but all the processes that are be put in place. And we're lucky that our operations director in Colombia has spent 16 years with a large German pharmaceutical company, and all he did is really sort of GMP and compliance. So he knows this very well indeed. So, markets very much focused the pharmaceutical medical market. The pharmaceutical market, I think, will happen quite slowly as the key pharmaceutical companies, over time move across to medicinal cannabis. But the key markets are really the medical market, which I suppose in Europe is the regulated but unlicensed drugs market in Europe, where people are prescribing medicinal cannabis, and that will be the whole range of cannabinoids. But in terms of setting those quality standards, that also we feel cascades down into the well-being market as well, even the cosmeceutical market in terms of dermatological markets, and even the food and beverage market in terms of the standards that they would require. And so our range of products covers all the cannabinoids. So, the initial products we have are very much based around high CBD with low levels of THC, with all the other cannabinoids in there, moving to one-to-one products and then high THC products, CBG products. We're doing a lot of work with one of our key advisors is a lady called Dr. Inbar Maimon Pomeranchek, who's based in Tel Aviv, and she spends a lot of time advising us on strains, but also all the research in terms of new genetics, new strains, new cannabinoids. So we've built a facility where we want to be able to be reasonably flexible in terms of what we can do. We're not sort of growing bulk hemp and here's a CBD isolate and dumping it on the market and who wants it, but we want to be very specific around quality. What exactly do you need, such that we can plan that over long term and supply that market. And our markets are UK, Europe, Colombia, and then outwards into Latin America. We've not looked much at the US market, largely because of federal law in the US, but it's certainly a market that we need to start thinking more seriously about, with Joe Biden being elected, which could potentially change that. And at the moment, the US is by far the largest market in the world, and with the US doesn't necessarily it's not tinged with necessarily the regulation that you have to go through in Europe, for example.
Yeah, certainly different regime, and the pharma angle is, just today I think there's been an announcement that GW Pharma is being acquired by a larger pharmaceutical company. So big power moves being made, I suppose. Which
so it's starting.
Yeah, it's starting. Exactly. Cool. So thank you for that. I mean, maybe from a business perspective, and you talked about startups at the beginning on a kind of general level. How many kind of pivots have you had to make? And, particularly with COVID, have you had to be quite adaptable and sort of change things up?
In terms of Avida Global, so probably our biggest pivot was almost this time last year. So we were doing a big Series A fundraising round, and we, in fact, it was probably a week from now, had a big event in the city at our lawyers, and lots of investors coming along. We were presenting, this is what we wanted to do and the big plans, and raising lots of money. And literally, almost 1 week, 2 weeks after that, you suddenly started to see the headlines which first of all was just the one case in Wuhan, and then the person that came back to York University here. And, before the sort of panic started ensuing, I suddenly realized this is going to be serious. And so we took a decision at that point to actually, there's no point in trying to go and raise a huge amount of money at the start of a pandemic. And it was absolutely the right decision, because a lot of the big investors that were very interested in what we were doing suddenly saw all their portfolios nosedive. And so for the next literally 4 months, everybody was focused on their own portfolios and what they needed to do and how they reacted to it. So we pivoted and decided to, rather than going for a major rollout of greenhouses and massive post-harvest room, we scaled everything back down and went for a much smaller raise and focused just on a smaller production area. Having said, being a small production area at the moment, it's still pretty huge. It's 100,000 square feet of production, and fairly substantial post-harvest room with extraction, etc., but not as big as we were thinking. But in hindsight, it's actually, that was a good decision, because, in this business, you do make mistakes. It's an organic plant. It's, how the plant responds in the area that you're growing is very different. And, it's not just about setting up a facility, press the button and it all happens and it's perfect. There'll be a lot of learning. There is a lot of learning as we go along and improvement. And, it's better to do that on a smaller scale than on a bigger scale. So that was probably the biggest pivot.
And it sounds like a good decision to make. Have you re-engaged with the kind of fundraising environment again?
So that took us through most of last year, and we ended up raising, in the end it was about 4.1 million, I think it was, which we closed last year. And, just working in startup businesses or this sort of businesses, if the cash is there, you take it. So, whilst we're not in, doing another big raise, you're effectively fundraising all the time, really, in terms of getting working capital into the business. But, it was good completing that raise last year because it's allowed us to finish off everything we want to do, get the business into production, etc.
Yeah, I mean, that's great news. So as we come to the sort of end, maybe some sort of future gazing from you, if we may. How do you see this kind of moving? Do you think it's been going a bit slower than everyone hoped? I mean, there's a lot of people trying to produce for the medical market, and perhaps the markets haven't opened up as much as we were hoping. What's your general view on now and where it's going?
Well, general view is it's changing all the time. And, what I've learned in this market is don't assume anything because it will change. And, when we started, you look at all the projections in terms of where the market, goes. So going back to 2018, where the market's going to be in 2021, it's going to be, 50 billion or whatever it was. And, all that I think has moved out by 2 years or what have you. And then there's, regulation, which is coming in, regulation that is changing all the time. Certainly in the UK, everyone is, or not everyone, but a lot of people focused on novel foods, as we are at the moment in the UK. But, there's other regulation that is being discussed in Parliament in terms of, the 1 milligram rule and, the amount of THC to be included and et cetera. And it just seems to be and will be an ongoing discussion. And, quite my own view is it's, how I started this off, if you like, in terms of my interest, in terms of the difference between Western medicine and Eastern medicine. And, cannabis literally crosses that divide in terms of it is very much about Eastern medicine in terms of the whole plant and everything that it can do in terms of the different constituent parts of the plant, whereas Western medicine thinks on single molecules, producing a, synthetic drug, if you like. And I think that's where the problem lies between, how do you embrace, such a wonderful plant like cannabis in the medical world? And it's those sort of two medical philosophies coming together, really. And we need to embrace it and clearly have regulation around it, which is required both for quality and control, but in a way that gives a lot of people access to what is a very, very beneficial product.
Absolutely. Great way to end it. Thank you. East meets West. Fantastic. David, that's been brilliant. Thank you very much. And obviously it would be great to have you back on and see how things progress with Avida Global. So you're welcome back anytime.
Perfect. Thank you very much.
Brilliant. Thanks, David. Thanks for joining me for that. Hope you enjoyed it. If you need any help navigating the cannabis sector, whether it's legal advice, fundraising strategy, business development, or just some general help, please do get in touch. You can find me on LinkedIn and at www.canverse.global. That's CANVERSE. In the meantime, enjoy your week and keep well. Cheers.